Today we're going to be talking about HIV lipodystrophy, and we have Joseph here today. And HIV lipodystrophy is caused from having HIV, and also early on there were some medications that actually caused fat to kind of disappear from people's faces and be redistributed to other areas of the body. So with the face, you can see, Joseph's been going through a couple treatments, and he has a little bit of loss of tissue here. Now we've been working here already in this area here and along this area, along the cheekbones as well. Now there are several treatment options available, and those include the liquid silicone, which we're going to be talking about today. Also, we have Sculptra. And Sculptra is an agent that relies on the body's natural skin cells to stimulate new collagen. And so it is a great treatment, but I think it works best in people that are in their 20s, 30s, and maybe early 40s, because the fibroblasts are really healthy in young skin. But as we have more birthdays, they become a little bit lazier and less effective. And so I'm not sure it works as well as what we're going to talk about today. There's also a treatment called Remedies, and that is calcium hydroxyapatite, which is basically like a bone type product. Now with that one, the disadvantage is that if you inject it into a blood vessel, it'll cause death of the tissue beyond that blood vessel that you treated. And I've actually had that happen to a patient. So that's another one that's not my favorite. My favorite is to do liquid silicone. It is FDA approved for eye uses. Now with this product, you can see it's like an oil. It's considered biologically inert, which means it's very, very unlikely to have any kind of allergic reaction. Now, in the early days, silicone was not FDA approved, and people were using it in the tissue for breast augmentation and for face augmentation, and there were some really big disasters that occurred. And so there was a lawsuit by Dow Corning against the manufacturers of this product, of the old silicone products. But what they found during that lawsuit and during the investigations was that there were no real legitimate things that the silicone did in terms of causing connective tissue disorders. So in the early 2000s, this form of silicone was FDA approved for eye use, and as doctors, we can use it for off-label applications. And it's a really terrific treatment, and I've been using it for over 10 years to treat lipodystrophy. And what I love about it is, unlike the other ones, this one is going to last forever, and in most cases it looks and feels natural. Now, since I've been using it for so many years, the only thing that I've found that it does that's really that I don't love is, in some cases, if we use a lot of it in one area, it can get a little bit firm or hard. And I have to tell you, not one of my patients has ever complained about this firmness. And sometimes if I point it out to them, they're like, oh, I never noticed that. And it really doesn't bother me. So you've had a couple treatments, and it's a little uncomfortable, wouldn't you say?
Yes.
But are there any other things that you find to be difficult with it?
No, I mean, this is my second go-round with facial injections because of my lipodystrophy, and the injections themselves are painful, but other than that, I'm very satisfied with the results.
Okay. So other than the pain with the injection, there is a little bit of bruising that can occur. And like I said, I really don't see any other major side effects. So we're going to demonstrate the injection of this product, and we try to do different tricks to make it a little bit more comfortable. So we'll give Joseph a little vibrator. And were there any areas that we talked about that you didn't want to have treated, or where you want to focus today?
Well, we've been focusing in my cheeks, and we just did a treatment 2 days ago, and I'm actually still a little sore. You talked a little bit about doing this area in here.
Sure.
So I don't know if you want to, and they've numbed me there, so I don't know if you want to focus on that.
Let's do that, because I think that's a great idea. Because, the rest of your face is looking really good.
Yeah.
So we're just going to do this. And what we do is we do a microdroplet injection, where we're just doing tiny little drops. And you can imagine getting multiple injections into your skin. It really is not pleasant. But we just do tiny little drops, and the purpose is to go as deep as we can. And you can see Joseph squirming a little bit, which anybody would be, I have to tell you. And just these tiny, tiny, tiny drops. Now we build it up slowly because we don't want the drops to pool together. So what we'll do is we'll do these small injections at monthly intervals to allow the silicone to get embedded into the tissue with collagen bundles. And you can see just after one treatment here, we've really made a big difference in terms of the convexity of this area. And so this will take probably like 4 treatments, maybe 5, in order to get full correction. These are just half cc syringes. We're going to go to the other side, and we'll do more of the same. You can see this is really hollow here, so we just place the silicone in the areas where there's the greatest amount of indenting. Now, the FDA approved treatments are going to be Sculptra, which we've been using on Joseph. And how do you feel like those have been going?
Good.
Good?
Mm-hmm.
And then the other thing is the calcium hydroxyapatite, which is the Remedies treatment.
I mean, I feel like the results, we've only been doing this since October, and I feel like the results have been really good, and a lot of my friends are noticing it as well, and it looks natural.
Yeah, and for the most part, it's going to feel natural too, unless over time it hardens up a little bit. Mm-hmm. And you can see there's a little bit of a bruise, and the way we manage that is just to hold firm pressure. And so, Bunny, go ahead and take over for me, please, there. And that's all there is to it with this treatment. We do it at monthly intervals. The Aftercare is pretty simple. Just apply ice, 10 minutes on the hour for the rest of the day, and that's all there is to it.
Great.
So thank you so much.
Thank you.